So it's Jahan again here from JY Physiotherapy, and today we're going to talk through our setting positions for our starting points when we do our Pilates exercises. We've got Jess here who's training at the moment with Pilates, and we're just going to start off with how to set our lying position. So this is the position that we start off with when we're doing any abdominal work, any bridge work. And so what we're going to start with, we're going to look at the neck and head position. So in this position, we're going to just make sure that the chin is nicely tucked. And as you tuck the chin, you'll find that the neck will stretch out at the back. We're going to keep that position, and we're going to imagine the shoulders. We're going to draw those shoulders up towards our ears, and then round them down and bring them down so that they're away from the neck. So the neck is long, the chin is tucked under. And let's think about those ribs now. So when we're talking about ribs flaring, as we lift our chest up, we feel our ribs will come up. So if we can show that, Jess, as you lift the ribs up and then slowly lower them down. So we're imagining we're just dropping those ribs down. And then finally, we're going to think about our pelvic position. So we're going to do some pelvic tilt. So we're going to tip that pelvis up, as in we're going to do a pelvic tilt. So if you could tip it up and slowly arch up the other way. So we're going to take it all the way the other way. So we're just getting the back moving. Just if I can get you to put your hands on your chest for a second. And then just tip the pelvis as far up as you can. So arch the pelvis up. And then take it the other way, so we're making a gap in our back. So we're lifting our back off the floor, so we're arching the other way. And then we find the midpoint. So somewhere in the middle of that movement, and we're going to switch on our stomach muscles, tighten up the belt around our abdominal core, and hold that position there. As we switch it on, we're just gently tensing. So if we tense up a maximum contraction, so tense it really hard, we want to do about 50% of that as a contraction. Then we're going to think about our leg positions. We're going to make sure that our feet, so bring our feet together. We're going to V our toes apart. So we're going to separate them. And then let those heels join them. So we're forming a train track position, so the knees and the hips are all in line. And here we are, we're now set to start our work in this position.